Hi, everyone, and thanks for joining another session of RxSight Ed, an educational session brought to you by RxSight as part of their Light Adjustable Learnings program. In sessions like these, we talk to friends of ours like Dr. Sundell from Sundell Eye in Virginia, Minnesota, to see how they've implemented the light adjustable lens technology and how you can learn from some of the ways they've done it. I'm joined here by Dr. Bridget Sundell, a longtime friend of mine. Dr. Sundell, hello. How are you?
Hello.
Good
Thank
to
you for
see you.
having me.
You're welcome. Thanks for joining us. I'd like to start first, maybe by just asking you a little bit about Sundell Eye, how long you've been in practice, and what your specialty is, but also what you've tried to grow into over the past, few years.
Certainly. Um, so I've been in Virginia, Minnesota since 2002 and was part of a small group practice prior to Sundell Eye Associates. In 2010, Sundell Eye Associates was started, and I've been basically solo and since then. And I have one optometrist associate that works with me. And over the course of the last 14 years, I've built my own clinic and own ambulatory surgery center.
That's great. And tell me where refractive cataract surgery fits within your program.
So I don't do like laser assisted refractive cataract surgery, but I've used basically all the different specialty lenses that have come up over the years and have had good success with all of them. But really, one of the limiting factors for me was patient satisfaction with the various lens implant types. And so we've moved toward the light adjustable lens in our practice just because of the better visual outcomes and much better patient satisfaction.
Great. Well, that's what we want to talk about today is how you've made those changes, how you've implemented it, how you've brought your staff along, and then what it's like to work with the patients through the process. So first, um, tell us about how you decided to start using the LAL and what decisions went into that.
So it started probably about a year and a half ago. I went to an informational session on another practice about an hour away from our practice, and I remember hearing about the light adjustable lens over 20 years ago when I first started in practice when it was in development. And I thought it sounded really interesting. And it just took a really long time to get approved. And so it sort of became on the back burner of my brain. And then I went to this informational session with RX Sight, another practice, and learned more about the lens, asked a lot of questions. They shared some of their patient outcomes and some testimonials from their patients. And I thought, that sounds really fascinating. So on my own, I reached out to the RX site rep to see if they would come to our office or do a webinar so we could learn more about the lens and see if it would be a good fit for our practice.
So then so you're interested in it. What are some of the hurdles you need to clear when you're about to implement it? You've decided to do it. Now what?
So we spent a lot of time talking to the reps about it, and certainly the cost of the light delivery device. And really, inside of our practice, when we implement something new, we think about it for a long time before. And so we have the motto of think now, do later. So the administrators and the managers, we talked about it. We actually talked about it at one of our staff meetings. And so it was sort of a slow process, not, okay, I'm going to do this. It was a process of let's think about it, make the decision. And once we made the decision, then we started a lot of behind the scenes back end work to make it successful right off the bat.
That's really interesting that you included your team in the process before it even started. So tell us about that. How did you set that up and what did you ask them or tell them and how did they respond?
So I think it started with Adam coming to our office, one of the trainers, and he gave us a whole presentation about the lens. And everyone was really excited because we use a lot of specialty lenses and they see the excitement that patients have. But they've also seen some of the pitfalls with visual side effects that patients have and the complaints. And so it was really easy for them to become excited about the lens just because of what it can deliver and the better night vision and lack of visual side effects. So once we did that, Then probably at the next few staff meetings, we talked about process and it sort of brainstormed like, what would this look like? What would we say to the patients? Came up with our templates and how we want to present the lens to patients, how we want to make things as smooth as possible.
Okay, so let's talk about those templates. Uh, by the way, just before I do that, it's really impressive that before even implementing the technology or signing for the LDD, that you had your team approach. It's a real signal of what you've built for team culture, which we've talked about before, and
Yes.
super impressive. So good job at that.
Thank you.
I want to talk about the templates. So, what kind of template did you start with? Can you share a little bit about the mechanics of that workflow?
So let me think. So one of the things that we talked about is how to present this to patients as another option for less dependence on glasses. And so I always use the word less dependence because nothing's perfect in life, and the staff knows that. There's no lens that gives you 100% spectacle independence for all distances at all times. And so we really talked about language of how to present that to patients and setting expectations. That's key when you're using advanced lens technologies is to patients for them to hear what's realistic. So we came up with language surrounding patient expectations, what's realistic, and also the time frame because this lens is a journey. And so I describe it as to patients as three phases. Phase one is the surgery, phase two is the healing, and phase three is the adjustments. And so during that time, I tell them, I'm going to be with you on the journey, but you have to have a little bit of patience and be willing to invest the time for the visual outcome that you want.
That's really important of setting those expectations. I've got mentors in the field who say that they need to use verbal anesthesia, right? And it sounds
Yes,
like that's what you're doing from the very beginning.
absolutely.
You talked about the way you say it, to how the way you describe it to patients, and you mentioned how you talk about the investment of time and the journey. What about the technology itself? How do you describe the actual lens to patients?
So I usually use the brochure and I show them the picture in the brochure that shows the side-by-side lenses where one is being treated by the ultraviolet light and then that lens where it has changed shape. And so I show them that picture and tell them that this lens allows you to customize your vision after your healing because there's normally a little residual astigmatism or nearsightedness, farsightedness after cataract surgery that we correct with glasses if you choose the monofocal lens implant. But with the light adjustable lens, you can correct those little bits of residual refractive error by changing the shape of the lens. And I tell them you can adjust it up to 3 times, which allows you to trial your vision before you make the final decision of what you want your vision to be based on your activities and your lifestyle. And so a lot of people that have had previous surgery in the past, they understand um, the investment they're making in an advanced technology lens such as this. And really, you could almost say it's like having LASIK at the level of the lens rather than the cornea, but you can adjust it 3 times. And so I love that about this lens. You're not changing the shape of the cornea, which is an additional surgery and extra healing. You're changing the shape of the lens implant. And
Dr.
so,
Sundell, sorry for interrupting you. It's so fun to hear you say that like that. It's almost like having a LASIK procedure at the point of the lens with
right.
3 adjustments. It's a really succinct way to talk about potential outcomes plus the patient participation. What were you going to say? I interrupted you.
Um, when I describe that to patients, especially if they've had previous surgery in the past, it's amazing how light bulbs go off in their brain. They're like, okay, they get excited. And when you tell them you can adjust it, and then I tell them you can come back and give me feedback of what's working for you, what you'd like more of, what you'd like less of, and then we can adjust it again. And so I tell them it allows extreme flexibility during your decision-making process of what you want for your vision. And patients love that. They love to have the options and not having to make the decision up front of what they want their vision to be.
Let's talk about that for a second because what you're saying is it gives patients a peace of mind to know that they
Yes,
can, walk around and see what they like. Does it give you peace of mind compared to other lenses?
it absolutely does. And so with other specialty lenses, there's a lot of hand holding and just angst on my part of patients wanting patients to be happy. And um, there are side effects associated with those lenses. And so this gives me a sense of peace that people are going to do well. And if I want to change something or if they want to change something, we have the ability to do that. Because there are certain corneal conditions or various ocular conditions, dry eye, where things can be slightly unpredictable. And the other thing I love about this lens is you don't have to make decisions in rapid order. You can wait. And so if someone does have a little dry eye or they develop corneal edema postoperatively and we have to wait for that to clear longer, there's no urgency in adjusting or making a decision,
You can always just delay it a little bit.
right? And I tend to delay as much as possible if there's any uncertainty. And that's one of the things that the trainers drilled into us. And I'm okay with that. Some people like to just get it done and, get this person locked in and move on. But I'm okay with waiting because depending on the patient personality type, there's a lot you can do as far as empowering them just by waiting. And so if they're not ready to make a decision, and you can see that if you wait and tell them, just keep what you have and you can come back in a week or two and we can make the decision then, because sometimes they don't want to make the wrong decision. And you can see their anxiety that they're like, I don't know if I should do this. I don't know if I should do that. And I tell them, just wait. And so I don't rush people into making the decision for their final visual outcome until they're ready.
Well, tell me how your staff gets involved. Are they, because there is some extra work, do they look at this begrudgingly, like, oh, there's more work with this one? Do they prefer it over other technologies?
So I would say they don't really look at anything begrudgingly because we're here to help people, of course.
Hmm.
And they love this lens. They are so excited about this lens because they see how happy patients are. And a lot of the hand holding with other lens implants that have visual side effects, it falls on the techs because they take the phone calls and they're reassuring. All of us are doing that. So I would say this lens has created less work for them, not more.
Okay. Well, that's and I know you've got a great team, but sometimes, when we're out in the field, we hear people say, "Well, I mean, that lens might be impressive, but it's just way too much work."
Right.
When you encounter those folks, doctors or team members from other places, um, what's your response?
So I again think it's less work on multiple levels. So if you it's hard to know that once you start using it because I thought about that like, gee, this is a lot of appointments. And then once I started using it, so here's a couple things that have changed for me as far as workload. So for a toric lens implant or another specialty lens implant, I used to get 2 biometries minimum for consistency. And patients, I would tell them, I want you to come back and we're going to get another set of measurements before we pick out your final lens implant power, because I like to be really picky about numbers. And so they liked that, but it was an extra trip for them. It was extra work for my staff, but that allowed me to have 2 conversations with them about potential visual side effects because it's hard to absorb all this information at once. So that's one thing that I no longer do. They can have one set of biometry in a normal situation. So that's less work. Um, and then as far as post-operative visits, I think there's more post-operative visits with the adjustments, but with other types of lens implants, I think there's a lot of post-operative visits just to treat maybe a little tiny bit of dry eye, something that may be contributing to a less than satisfied patient. So that I feel like there's less work there. And when you think about the type of patient that is a good fit for a multifocal lens implant, there's a lot of brain power that the doctor's doing and talking to the patient, really sort of absorbing their personality, trying it on, see what it looks like. Is this person a good fit? And that just comes with time. After doing this for a long time, with light adjustable lenses, they are so forgiving, so flexible that you don't have to do all that mental gymnastics to find a good candidate. So I think they take me less time preoperatively for sure.
So I wanted to just ask you, just overarching, what is the biggest challenge that you've faced in implementing the light adjustable lens?
I think one of the biggest challenges was figuring out the flow for the adjustment days. And so the trainers were extremely helpful on that. And really, they tell you, you can do whatever you want based on what works for your practice, but here's the things that we found that work the best, and that is to lump them on one day rather than scatter them throughout your clinic. That is 100% true. And so if you think about your psychological bandwidth focused over here doing light adjustments and then you pop over and see a pre-op, it's just not ideal. So I have chunked them into half days. And so I have all the light adjustable patients come. And so one of the tricky things was figuring out the timing. Should I have them come how far apart? How many, what's the template? And so we came down to sort of trial and error, what works for our practice. And so that's kind of a learning curve where you feel a little bit uncomfortable because we're so used to our 10-minute template routine. And so it's a little bit different. But then once you start doing the adjustments, you get to know what works well and who dilates fast, who doesn't dilate fast, and then you can strategically place them on your template to make the best flow.
Great feedback there. It's another good example of what works in your practice versus others, right? Some people are love having them mixed in with their regular flow. Some people, like you, have just talked about the real benefit of perhaps having a cohort of patients where you can just get in the groove and really get in the zone on adjustments and those kinds of conversations. So really important that listeners know that there's could be a benefit for both depending on how you set up the flow in your other areas of your program. So if you're talking to somebody who's about to implement the light adjustable lens, what's the biggest piece of advice you have for them?
That's interesting because there's so many good things about that lens. And so I would say for sure, if you can afford it, take the leap. And so this will definitely be profitable for your practice and likely replace a lot of the other specialty lenses that you're using. And you'll love it. You'll just really love it. Patients love this lens, and getting over the initial hurdles of implementation, which are normal growing pains, after that, it's really smooth sailing.
You brought up a really good point again there that I want to kind of pull the thread on a little bit. You said you'll be confident enough to maybe replace other lenses in your arsenal. Has this been a practice builder for you, or has it just taken share away from other fixed lenses?
So it's both. And so it's been a practice builder for sure. And so my premium lens implant percentage has gone up, I'm going to say between 5 and 10% after implementing this lens. And it's replaced most of the other lens implants. I'll still use them in certain circumstances. Some people don't dilate well enough to have the light adjustable lens if you have to use a Malugin ring. And so some people just don't qualify, but they're really motivated to have a specialty lens.
There is something about your confidence in the technology that must be there to really promote it. Do you think that's true? Can you talk about that?
I think definitely. And so, historically, I've used other lens implants, but there's always been in the back of my mind, I know there's going to be a certain percentage of patients that aren't happy. And that's just the way it is. And so I think that holds people back in a lot of ways from using multifocal lenses or other technologies, just patient satisfaction with the light adjustable lens. They see my excitement. And I do tell them that in my entire career, this has been my favorite lens. And if I had to have cataract surgery tomorrow, I would absolutely get this lens and recommend it for my family because I see the flexibility in it. And it's hard for patients to know what their vision is going to be like after cataract surgery because they just can't see it preoperatively. And so once they have their cataracts out and they can see what their vision is going to be like and make the decision after the fact, it's so much better. And so when they see my excitement and our technicians' excitement, it's really that's helped grow the practice. And also, I've done so many of these now that there's people in the community. We live in a small town, and people are like, I want the lens that so and so had. So word of mouth, even just having used it for a year, word of mouth is getting out there, and people want that lens.
I've got a couple more questions for you about that. We hear a lot of people say, well, this and every other premium technology, there's some real merits to it, but it's pretty difficult where I live. I mean, this is a market that's pretty tough and it's a small town. And it's just people don't have the discretionary spending. What's your response to that in a city or town like Virginia, Minnesota?
Right. And you would think that, and I've thought that in the past too, but people do have discretionary income. It's just, I think you have to talk about it in a way that's exciting because here's a good example. In Minnesota, we have lots of toys like four-wheelers and snowmobiles and lots of outdoor equipment that people use all winter long, boats, boat trailers, and all that's really expensive. And so I tell people, this is something that you're going to use every second of the day that you're awake. And we all have these things like four-wheelers and side-by-sides, and you don't even use that all the time. It sits in your garage. Those things are $15,000, $20,000. And when I say that, they're like, you're right, I do have a four-wheeler and I never use it. And so it's getting them to understand the investment and the long-term vision that they're going to have with this lens. And so a lot of times people's spouses will be there like, yeah, the wife will look at their husband and say, yeah, you never use your snowmobile anymore. And he's like, you know what? Why don't you go ahead and get those lenses?
That's great. Yeah, and I worry about the conversations on the way home of how many four-wheelers are getting sold
Exactly.
just the
Exactly.
garage space. I
Right.
want to ask you one more question, and that's just an overview. Can you describe just the difference between fixed versus adjustable?
Like how I would describe that to a patient.
Yeah.
So I tell them, I describe it as the monofocal lens implant, which is fixed and non-adjustable. And I tell them if you choose that lens, you'll fine-tune your vision with glasses afterwards. Or if it's somebody that wants less dependence on glasses, that has had a previous surgery in the past, I tell them you can always have additional surgery to correct residual refractive error. And so most people understand the concept of monofocal fixed lens glasses. And then the adjustable lens, again, I use that picture in the brochure from RxSight, and I show them the actual UV beams hitting the lens implant, and then you can see the change in the shape of the lens implant. And so then I describe the adjustability of it and that you can adjust it 3 times based on what your visual desires are.
Well, Dr. Sundell, this has been a great session talking about how you've implemented the light adjustable lens. And I'm so excited for you and the
Thank you.
confidence that you have in it and how much it's energized your team and
Yes.
what it's doing for your community. I want to thank you for spending time with us today. And I also want to thank RxSight for their RxSight Ed education series, light adjustable learnings on how to implement this technology in your practice. Thanks everybody for joining.